What types of therapy are there and what type of therapy should you pursue? Psychology, psychiatry, family therapy, social work. Oh my gosh, all the options. What do you need? Mended Light.
Mended Light.
So joining me today is licensed marriage and family therapist Chase Brewer, who's been a member of our team for how long?
Almost 5 years.
Dang, son, almost 5 years of Mended Light. Chase, what are your specialties? Let the people get to know you.
Well, as Jonathan has introduced me, I've been with Mended Light for 5 years, and my specialties that I've been working on is healing from infidelity, trauma, recovering from trauma, and then I've been working with couples in relationship conflict and helping them resolve that and growing closer together and emotionally connecting with each other.
Parenting, families, all that good stuff. Chase is your guy, especially if you live in Utah. This is your guy. So let's talk about different types of therapy, because when I decided to become a therapist, I was like, I want to become a therapist. And my parents said, what kind? I'm like, I don't know. And they're like, well, what type of training do you need? And I'm like, I don't know, because I was 20-something and stupid. But then I learned a lot of things. So let's break it down. What, off the top of your head, what are some types of therapy?
Yes, there's quite a few different types of therapy out there. There is social work, there's mental health clinical counselors, there's psychologists and psychiatrists.
What's the difference between I'm just going to pop quiz Chase right now. What's the difference between a psychologist and a psychiatrist?
My understanding is a psychiatrist can prescribe medication to you. A psychologist has its limitations, but it's more of looking within the sense of self and the cognition of your struggles.
So a psychologist is very individually based, and like you're saying, what are you struggling with as an individual? They tend to focus on personality disorders, mental health disorders, mental illness, but they cannot prescribe medication. Psychiatrist traditionally is like a psychologist with the addition of we can prescribe meds.
Yeah, they do a lot of assessments.
In my experience, a lot of times, not all the time, I don't want to get anyone angry here. A lot of psychiatrists do more med prescribing and less therapy these days, and they'll refer you to a psychologist or to another therapist to do your therapeutic work. What are you?
I'm a marriage and family therapist, so there's another type of therapy for the specific needs that you're struggling with.
Yeah, Lmft. Why would someone go to see an Lmft instead of a psychologist, and why would someone go to a psychologist instead of an Lmft?
You would want to go to a licensed marriage and family therapist because we specialize in the family dynamics with a systems perspective versus a psychologist, as we've discussed, where it's more about the cognition and the sense of self type of struggles.
And it's funny, like a lot of psychologists do couples and family work, and a lot of LMFTs, dabble in depression and anxiety and get trained in trauma. I mean, the fact is, a lot of therapists, they pursue their education, and then afterwards they get trained in a lot of other different things to expand what they're capable of. But you do want to meet with someone who is trained specifically in your needs. So for example, I used to help couples who there had been an affair, there'd been betrayal, and I wasn't very good at it. My heart was in the right place, and I had, a lot of skills from my education and from my experience as a therapist, but that was a very specific type of training, betrayal trauma. And I did the best I could, but man, once I trained in that, it just opened up this whole new world of not only people that I could help, but actually being able to help them. Because what a lot of people don't realize is that a therapist can do sometimes even more harm than good if they're not trained and qualified to help you with a specific thing. This is why, for example, Mended Light, if you come to us with schizophrenia, we're going to refer you to somebody else because we are trauma trained and trauma focused. And you did a lot of couples and family training in your master's program, but you've since trained in betrayal trauma and then abuse, physical abuse, sexual abuse, emotional abuse, loss, and grief. So you are not just couples and family anymore. Right. You're trained in all these things. What has that done for you and your ability to help people?
What that has done for me is develop more confidence in being able to provide the content that they need to hear and to apply in their lives to grow their relationship and to heal.
Yeah, absolutely. So let's talk about social work. What does a social worker do, a licensed clinical social worker?
It was described to me that a social worker can dab in different types of therapy. They have a broader range of type of help that they can provide. But when it comes to like marriage and family therapy, if you draw this big circle, that's social work. Marriage and family therapy has a smaller circle within that network that's more specialized in that. So social work can cover a broader range, but they're not as specialized.
They're not as specialized,
trained.
and they tend to focus on being plugged into the community, like resources in the community, knowing where to direct you to get different help and support that you need. And so once again, what type of therapy should you pursue? I think it comes down to two things. Like, what type of therapist are you dealing with, number one? But number two, what is your therapist trained in? Because we're more than just our licensure. We're more than just what we graduated in. Because I graduated in couples and family therapy after getting a bachelor's in psychology. I got my master's in couples and family therapy. And so I did depression and anxiety in couples and family work, and then have since gone on to train in trauma. And specifically for me, betrayal trauma and helping couples work through affairs. I was not qualified just as a licensed marriage and family therapist to really help people with betrayal trauma until I trained in that. You were not especially qualified to help people through abuse until you trained in that and had a lot of experience in that. And now you're ready to rock.
Yeah.
Right? I've known clinical psychologists who did couples work, and they should not have been doing couples work because they were not trained and experienced. And they would bring their individual therapy skills to couples work and wreak havoc. I've also known clinical psychologists who went ahead and continued their training and did a lot of family systems work in their training, and now they're as qualified as any licensed marriage and family therapist. So the first step, watching at home, is to identify, what are my real needs?
Yeah.
What are my real needs and goals? What do I want to accomplish? The reason I became a family therapist is because nobody exists in a vacuum. So I'm going to lay on my bias very thick, Chase's as well. But if you talk to a LPC, a licensed professional counselor, which is another kind of jack of all trades, at least by title, any LPC licensed professional counselor is going to specialize in something. And so you're going to want to ask that counselor specifically, what are your areas of expertise? And one thing that I would say is, the broader they go, the more things they list, the less likely they are to give you the care that you need, because they're not, you're looking for someone who specializes in exactly what your need is. Right. And so I got that advice when I came out of school. I was talking to another therapist, and I was like, so I'm about to market myself, and here's my list of things that I can help people with. And he's like, don't do that. And because it was a huge list. And I'm like, why? He says, what you're promoting yourself as is jack of all trades, master of none. And what people really want when they're seeking a therapist is, I'm looking for somebody who can help with my specific situation. And I haven't told you this, but you know how they say therapists should get therapy? I recently decided to start seeing a therapist.
Right.
And when I was searching through what people's expertises were, the longer their list, the less likely I was to choose them. I knew exactly what I was looking for, and when I saw therapists who were like, I specialize in this, and I'm like, that is it, that is my thing, I wanted that person. Like I could say, clinical psychologist, social worker, Lmft, licensed marriage and family therapist, LPC, licensed professional counselor. That matters, but what matters most is, what are the areas of specialty and training and experience for the therapist that you're working with?
Very true. Then the question comes, there's still so many different types of marriage and family therapists out there, or social workers out there. You may narrow down your list, but then you're asking yourself the question, well, will I fit with this type of therapist? Would this therapist be a good fit for me?
Yeah.
And so I've had a lot of clients reach out to me with this concern and putting a lot of pressure on themselves. And I related it to therapists are like donuts, right? There's a lot of good donuts out there. There's a lot of good therapists out there. And so for you as the client looking for a therapist, don't put so much weight on your shoulders trying to find the one. Remember, there's still a lot of good therapists out there.
It's not a lifetime commitment.
It's not a lifetime commitment. And if you don't feel like it's the right type of donut, it's okay. I mean, it's a good donut. Eventually, you'll come across your Krispy Kreme, and you'll find that type of therapist that you want to
What's
stay with.
your favorite donut flavor?
My favorite donut flavor?
Yeah.
The apple fritter. I know it's not necessarily a donut, but it's the apple fritter that is my go-to.
Okay. Because I like the maple bacon bar, with the bacon pieces on it.
Very good. Very tasty.
And the thing is, that it's the same thing with counselors. Do not worry about offending a counselor. Like, you start therapy and it's not a fit, and a lot of people don't switch because they don't want to offend the counselor. it doesn't, if I'm a decent counselor, it doesn't hurt my feelings. I know that I'm a great fit for some people and I'm not a fit at all for others because it's not just expertise, it's also personality.
Right. It's not about us. It's about you guys. And we want to provide you with the best care that we can give.
I've had people that were meeting with me and it wasn't a fit and I transferred them to Chase and they're like, that's much better. Right? Because once again, you have to know exactly what you're looking for. And maybe you don't. Maybe you figure out what you're looking for as you try people on, and that's okay. It's not just about what type of therapy you're looking for. Irwin Yalom said that it's the relationship that heals in therapy. Right? There's different theories, there's different modalities, there's different areas of specialty, but the thing that is most healing is the therapeutic relationship. Agree or disagree?
I very much agree. The therapeutic relationship and empathy that's exchanged between the two.
Yeah.
That's the secret ingredient.
And so you got to find someone who's a good fit for you. Might be this guy right here. So this has been Ask a Therapist or Ask the Therapists. Oh, I'm so excited. How do you know if you have emotional trauma? This is another Ask a Therapist video that we did that might interest you. Check it out right here. If you live in Utah and you're interested in meeting with this fine specimen here, there is a link for a complimentary 15-minute consultation with Chase in the description below. Or you can go ahead and bite the big one and schedule a full 80-minute first session. You can do that in the link below. What would you like to ask the therapist? What would you like to know from us? Sound off. We read these comments and they feed these videos. So we want to know, what is your most burning question about life, relationships, or mental health? I want to thank Chase for joining me. Explode it. We'll see you next time. Jonathan Decker, Chase Brewer, Mended Light. And here's that video we were telling you about.
Please click on it.
Do it. Do it.